welcome to another episode of MedTalk. Your hosts of this evening are Sofia and Raffaella. In this episode, we will cover the evolution of heart surgery and how this surgery increases a person's quality of life. So, Sofia, how does the heart works? Do you really know? Well, I know that the heart is a muscle that is located at the center of our circulatory system and it pumps blood to our whole body. Yeah, that is sort of true, but actually, blood is in charge to send oxygen and nutrients to every part of our bodies. Also, it carries away the unnecessary carbon dioxide and waste products. Oh, and I think that it was the size of our fists, right? Yeah, but a little bit larger. I think you know this. What is the name of that guy that performed the first successful heart surgery? Oh, you're talking about Dr. Daniel that one. Hale Williams. Yeah. Yeah, he was a surgeon who performed the first successful heart surgery in a human. He was able to make this huge milestone on surgeries because he didn't use any modern tools or antibiotics. He couldn't even check on x-rays. And what was the patient's name? Oh, he was called James Cornish. This surgery went amazing because he was able to be discharged after only 51 days. Oh, this is interesting. I knew this, but I wasn't aware of how important Dr. Williams was on the medical field. But I also heard that he was a pioneer of the open heart surgery. Is it true? Kind of. I mean, he's considered a pioneer of open heart surgery because he was the first one to introduce this procedure to the US. Oh, I didn't know that. The other day, my grandpa went to the doctor and he told him that he needs open heart surgery, but he isn't sure if he should get it. Do you think that he should? Well, to answer this question, open heart surgery is necessary in cases where patient hearts is not working like it should, and if they can't live a long life with their own heart. But also, open heart surgery is a risky procedure, but if his doctor told him that he needs to go through this, he should. I read somewhere that this is like a major surgery and that it's very risky because patients could die, especially if they have a problem before going to the operation room, and that they could get like bad reaction to the heart and strokes. Yeah, that's true, but it's more frequently when the patient has any additional diseases or disorders such as diabetes, an artery disease, kidney or lung disease. This means the risk is higher. I think that you should know that he'll deal with chest pain, constipation, muscle pain, trouble sleeping, and I don't remember which one else, but I know there are even more. Yeah, his doctor told him that he'll give him a prescription to ease the pain and discomfort, but it will obviously take some time for him to feel okay. Yeah, that's true. Will this operation cure his heart's illness, or will it just reduce the symptoms? Well, it depends on which illness he had or he has. But it just reduces the symptoms and the risk of dying. This topic is really interesting. Do you know anything else about this? Yeah, there are different types of open heart surgery. Are you interested? Yes. So, there exists the coronary artery bypass grafting, the heart valve repair or replacement, also the insertion of a pacemaker. This was the one where they insert a little device in your heart and they can track the beats of your heart, right? You're right. Then is the main surgery, aneurysm repair, and finally the heart transplant. But there's even more. I know you know more about the historical context of this surgery, and I'm interested about that. Okay, well, I can tell you about the first successful PDA surgery. If you don't know what PDA is, it's where your heart has a hole. Robert Gross was a surgical trainee, I think, and he was the first one to ever perform this surgery. He did it without the consent of his chief of surgery, and it was incredible. This technique is even done today because of how great it is. He pretty much closes the PDA with stitches or ligatures. Oh, okay. I really like this history, and it's super interesting. Well, sadly, this episode is coming to an end, and we hope you guys liked it and subscribe. There will be more episodes coming soon. We won't be the host, but there will be more. Thanks for listening us, and we hope you have learned something. Bye.